Thank you, everyone, for joining today for our press conference to discuss the safe return for students coming back to classrooms and school buildings. We're going to kick off this press conference starting with Christian Buggs, Chair of the Metro Board of Education, followed by Dr. Adrienne Battle, Director of Metro Nashville Public Schools, Mayor John Cooper, Dr. James Hildreth, President and CEO of Meharry Medical College, and then Patrick Johnson, Senior Vice President for Institutional Advancement at Meharry Medical College, and then we'll open it up for questions. So, Chair Buggs.
Good afternoon, and thank you all for being here. We're so looking forward to presenting our schedule for returning Metro Nashville Public School students to our school buildings after nearly a full year away from their in-person learning option for so many of our youngest learners. First, I'd love to thank the educators and parents around the city for making this possible and for continuing to collaborate with us. But as we prepare to start phasing students back into the classroom, I also want to thank the students for your patience, cooperation, and flexibility. I know the situation has created many challenging moments, and I'm grateful for the way we have all risen to the occasion. But we're certainly not beyond the reach of this pandemic. It can continue to do great damage if we aren't careful. So, we need more vaccines for our teachers. And I asked Governor Lee to make vaccines available to teachers immediately so that these essential workers can work as safely as possible in their classrooms. Finally, thank you to our Director of Schools, Dr. Adrienne Battle, and her team for the large amount of work they've done to get us to this point, always with one primary goal in mind: protecting the health and safety of our students, staff, and their families. Dr. Battle's thoughtful, careful, empathetic leadership has been instrumental throughout the last 11 months since the pandemic changed life as we know it in our community and around the world. With that, I'd like to welcome our Director of Schools, Dr. Adrienne Battle.
Thank you, Chair Buggs, for that kind introduction and for your tremendous leadership alongside the board as you've helped navigate us through this pandemic. Also, thank you to Principal Mormon and the staff here at Tom Joy Elementary School for lending us your space today and all of your preparations and continued work with our students and on behalf of the families that you serve. Thank you all for joining us today as we discuss our plans to bring students back into the classroom over the course of the coming weeks for those parents who chose that option. It was very important to me that we be as consistent and transparent with our families and staff as possible when making decisions about how to safely reopen our school buildings. I asked that parents make decisions first in September and then in December if they change their minds about whether to go to school in person or virtually, with the promise that we would be bringing students back when it was safer for us to do so. That promise was based on our metrics here in Nashville and not the demands of simply returning to the classroom setting regardless of community spread and safety. Now, we've seen the metrics that indicate community spread of the virus declining in the past few weeks to a level where it's safer for us to resume in-person learning through a phased-in approach. I'm pleased that we've reached this point and can share our phased-in reopening schedule with you today. Starting this Thursday, February 4th, students who attend our contracted special day schools, Genesis Academy and High Roads School of Nashville, will be eligible to return to their buildings for in-person learning. Students with exceptional needs who opted in for the in-person learning back in the fall, and those in grades pre-K through 4 will return on Tuesday, February 9th. And Monday, February 8th, will be an asynchronous virtual learning day to give teachers and staff time to prepare for students to return. On Thursday, February 18th, students in grades 5 and 9, our transition grades at the middle and high schools, will report to school buildings for the first time. On Thursday, February 25th, the remainder of our middle school students in grades 6, 7, and 8 will report to their buildings, followed by our high school students in grades 10, 11, and 12 on Wednesday, March 3rd, while we'll have in-person ACT exams a day earlier on March 2nd. I will acknowledge that some may say this is too fast, and some will say we aren't moving fast enough. But through a lot of conversations with our staff, school administrators, parents, and stakeholders, I feel this is the right balance of speed and safety to get our students back into the classroom. The continued phase-in schedule will be contingent and conditioned on the current or even greater reduction in community spread of the virus. We've had a tendency over this pandemic to run 10 yards and spike the ball like we're in the end zone when really we're barely at the 50-yard line. But I'm very hopeful that we can continue to reduce community spread and create an even safer environment for everyone. As you'll recall, we started phasing students into classrooms back in September of last year, starting with those who have the most exceptional needs first, and our elementary students began going back in October. As we were moving along with the phase-in plan, our community spread began to increase, resulting in more of our students and staff having to quarantine or isolate due to possible exposures, and we had to pause bringing back our middle school students due to rise in cases. Then, like many districts, we went back to all virtual after Thanksgiving due to the alarmingly high rate of spread of the virus throughout the country. My ask of the community and leadership throughout Tennessee is this: please don't put us in a position to have to pause this phase-in of students. Don't put us in a position to have to pull back and go to all virtual learning once again. We want our students back in the classroom, but if we see numbers spike up to the levels they reached back in December, that may not be possible. This isn't just me asking. Researchers at the CDC recently published a journal article stating that preventing transmission in school settings will require addressing and reducing levels of transmission in the surrounding communities through policies to interrupt transmission. So let's prioritize our children by making the necessary personal sacrifices and adopting public policies that do just that. I want to shift for a moment and talk about vaccines. If the leadership in Tennessee is serious about keeping staff in classrooms, we need to make vaccinations a priority now, not just on a chart, but in real life at this moment. So, Governor, as I asked you last week, please help us keep our great teachers and support staff in the classrooms by getting them the vaccine now, not a month from now. They should not have to drive 2 counties away where teachers are eligible for the vaccine. We need more supply. I know it has become second nature up at the Capitol to shortchange Nashville and Memphis, as has been done for years with the underfunding of the BEP. But I beg of you to please resist that urge in this situation. Prioritize our district for a direct allocation, because when we see other teachers across the state and other counties haven't been receiving the vaccine for weeks, while we're looking at weeks before Davidson County has enough vaccine to start prioritizing teachers, it simply sends the wrong message. We've talked about staffing before, and I would love for more Nashvillians to sign up to be substitute teachers, which you can do by visiting our website at mmps.org/careers. We have some amazing, talented substitutes working in the district now, and for those who are interested in pursuing this opportunity and willing to put in the time and effort for training necessary to meet the individual learning needs of students, we would love to have you join our team. To help create a safer environment, we've entered a partnership with Meharry Medical College for testing and additional safety protocols, which Dr. Hildreth and his team will discuss in greater details in just a few moments. We're also finalizing plans to submit our initial application for the use of approximately $123 million, of which $19 million will be directed by law to charter schools, and federal ESSER funding that will go towards our partnership with Meharry Medical College for enhanced safety measures in our schools. This will be in addition to direct school allocations for teams to meet the unique needs of their students, as well as nutrition services and strategic investments to achieve our focused outcomes for students in the areas of literacy, numeracy, social-emotional learning, and mental health, as well as transition between grade tiers and into college and post-secondary opportunities. I'm also grateful for the CARES Act funding that we received through Mayor Cooper and the Metro government last year that has allowed us to become a one-to-one technology district, meaning all students have access to a district-issued device of their own, along with hotspots available to any families who lack internet access. This has been essential to being able to operate in the virtual learning environment, and that technology will continue to be folded into in-person learning for the remainder of the year and when we return to normal, so we can enhance the educational experiences and prepare for instances in the future when students may not be able to come into the physical classroom. To those families who chose virtual learning for the remainder of the school year, I want you to hear that we are committed to the success of your students just as we were for those who are returning to the in-person environment. We will continue to wrap them with instructional and social-emotional learning support so they can continue to progress academically while learning remotely. To our staff, I want to thank you for your tireless dedication and commitment to supporting and educating our students during these challenging times. Now, I'd like to turn it over to our mayor, Mayor Cooper, to provide a few remarks. Thank you.
Well, good afternoon, everybody. And I want to start by thanking Dr. Adrienne Battle and Chair Buggs and our Metro Health Department, and to all of you, the residents of Davidson County. It's your healthy habits that have reduced the spread of COVID enough for MNPS to have an in-person learning option safely and responsibly. We are here today because the level of disease is improving. We have new resources and support through a federal COVID relief strategy, and we've learned from the experiences of school districts nationwide. We know more about COVID than we did before. Now, I know many students and their families are ready to get back into their classrooms. But Metro's COVID risk score is now at its lowest level since Metro Schools introduced it in November 2020. At 6.7, today's COVID risk score shows in-person education is a safe option for everyone, including our students, teachers, administrators, and all MNPS families. The risk score is calculated using 3 metrics: the 7-day average positivity rate, the 7-day average of new cases per 100,000 residents, and the transmission rate. Since Friday, when MNPS announced a likely return to in-person school based on the COVID risk score, those metrics have held steady or improved. Our 7-day average positivity is 9.3, down from 12.3 on Friday. Our 7-day average per new cases per 100,000 is 54.1, and that is essentially down from Friday. And over the weekend, our transmission rate remains stable at 0.82. Simply put, Nashvillians are doing the right thing. And with the new federal resources that enable robust safety COVID precautions, we can responsibly get our students back to the classroom, but let's stay the course so we can continue returning to normal. So please be safe, wear a mask, keep your distance from one another. If you feel asymptomatic, please get tested, and let's get all the way to the other side of this. And thank you. I'll turn it over now to Dr. James Hildreth.
Good afternoon, Nashville. First, I'd like to thank and congratulate Dr. Battle on her superb leadership during some difficult times. I really appreciate the fact that she's based her decisions on science, what's happening in the community. I do think it's safe for the children and teachers to go back to in-person learning, but there's some things that we all need to do. The safety of them returning depends on the community spread of the virus, so we can all do our part by doing the things to mitigate the virus. The other thing that's really essential is that teachers get the vaccine. As I have said for weeks now, teachers need to be a priority because opening schools is such a high priority for the nation. So it doesn't matter what district it is, what state it is, what county it is, teachers need to get the vaccine if we're going to get back to in-person learning and do it safely. I'm really happy to partner with Dr. Battle in getting people back in the classroom safely. What we're going to be doing is putting in a really rigorous program of testing, making sure that compliance is adhered to. And I think if we do that, she can make real-time decisions about keeping people safe as we return to in-person learning. So I'm excited about it, really thankful to be a part of it, but we have a part to do. We, the community, need to keep the virus in check, and that will also allow us to not have to go back to virtual learning. So let's get it. Like I've always said on the briefings, we've got this, Nashville. Let's keep our kids in class by doing our part. And with that, I will turn it back over to Patrick Johnson is going to give you some details about how Meharry is going to be involved in this process.
Good afternoon, everyone. As Dr. Hildreth and Dr. Battle mentioned before, there are some details to this new environment that we have been working on to create for our students and our teachers as they return back to school. As you all know, Davidson County is a large public school district. We have over 120 schools in our district. We'll have almost 50,000 students returning, another 17,000 faculty and staff returning back to the school system. And as you all know, larger entities over the course of COVID, whether it's sporting teams or live events, have tried to create the most safe environment as possible to carry on with normal business. We have done the exact same thing. We want to create an environment for our students, our young people, as well as those who have to educate them, that they can feel safer in this environment, whether the community spread fluctuates a little bit or not. It's a big part of what we do. But we also have additional work to do internally with the school systems. So we've created a model of more frequent testing, where we're using both rapid and traditional PCR tests where applicable, to make sure that we're identifying potential hotspots a lot sooner than possible, so that we can mitigate that and, capture it, whether it's at a school level or a cluster level, or maybe even a quadrant level. But the purpose, once again, is to identify hotspots that might arise, make sure we keep those from spreading throughout the system, so that we don't have to have a shutdown. The other thing is COVID compliance. A big part of all of us doing our part to make this a safe environment is making sure that there are no mistakes as we operate and go through our normal daily routines, where if you've been in some places, you will see people hanging the mask over their ear, more people gathering in one place than they should gather. So a big part of what we're trying to do and make sure that we implement it effectively is to make sure that everyone is compliant, from the administrators down to the students. And then what's most important is collecting as many data points as possible on a daily basis. Those data points will be analyzed, synthesized, and then given to the health departments, both at the state, the city level, the mayor's office, and Dr. Battle's level, so that we can make decisions throughout the week to make adjustments where we need to make adjustments, whether it's at the school level or a quadrant or cluster level, so that we don't have large outbreaks. It's a concerted effort. It's a very large operation. We've been working every single day for the last several weeks to get prepared for this, so that our families at home can feel safe about the decision to bring our students back to school. Thank you.
Thank you. Now we'd like to open it up for questions. Yes, sir.
I have two. Alex Apple, Channel 17 for Dr. Battle, if that's all right. The first would be, this comes on the cusp of the conservative legislature at the General Assembly talking about not funding national schools at all in the DEP to implement in-person learning. I mean, is it based at all on the pressure that you've been seeing? I mean, it's not just the legislature. Some parents wish that this had happened earlier as well. What would you say to that?
Thank you for that question. Since the very beginning of this pandemic and our planning here as a district, we have been committed to taking a very measured approach. Combining our phase-in process to the in-person learning with safety and the right amount of speed in phasing students in. That has been our commitment. Our commitment has been to follow the science, to make sure that we are well aware of the community spread in order to make an informed decision. I will tell you that as we're thinking about some of the pressures that have been placed on Nashville and Memphis, Shelby County, and I won't speak for Shelby County, but here in Metro Nashville Public Schools, our commitment has remained the same, that we will prioritize the safety of our students, our staff, and our families, and continue to educate them at a high level, both in the in-person environment and virtually. So while some of the conversations have been out there about how quickly or how fast we're phasing back in, we've not wavered on our commitment to be science-based about the final decision of the phase-in plan and at which point which grade levels would return.
And so I think you or Mayor Cooper said that the COVID risk score was 6.7. So what is there a number that needs to stay below for you to not have to pause the reopening plan?
So our COVID tracker is based on, of course, 3 metrics, which Mayor Cooper did hit on, and a 0 to 10 scale score. If you looked at our tracker, you will see that anything above 7 would put us in the virtual learning space. Our goal from the very beginning of the launch of the COVID tracker was to be under 7, to get there and to sustain that level of spread in order for us to determine it was safer for our students to return to the in-person environment. So as we begin our phase-in process, we'll continue to monitor the metrics. I think it's fair to say that we should all be prepared for some shifting in numbers based upon the metrics provided by the health department. But likewise, just as we're making this decision based upon the phase-in and the tracker being at 6.7, we will do the same thing if for any reason we saw spikes in our COVID tracker. We're going to take a very measured response. We're going to kind of measure the number of days and what kind of metrics are feeding in to us being above 7. But it is my hope that we as a city can rally around our schools at this point, that we're going to begin to phase them in and continue a downward trend with regards to all of our metrics so we can stay below 7. You know, being in this hybrid space of offering virtual and in-person learning is challenging for school districts. I think I can speak for school districts all across the country with regards to staffing. For our MNPS employees, we have surveyed our employees to determine what accommodations are necessary, and we're doing the best we can to accommodate as many of those accommodations as we can, given any concerns or underlying health conditions that might be present. At the end of the day, we do have to educate our students regardless of the mode that they're in, virtual or in person, so we will continue to do that. Also providing additional supports to our schools, for instance, how we're going to leverage our ESSER 2.0 funds as we're moving forward, how we're leveraging our central office staff, the call for additional subs, because our ability to operate our school buildings, like what we experienced back in the fall, matters. We want to make sure that we have trained adults in front of every student and that those trained adults can help us continue to educate our students at a high level while also providing for their social emotional learning needs and wraparound services.
Dr. Battle, assuming that students who return in person will be able to stay in person, how will this impact students and families who choose to stay remote? Are they going to lose access to any services? And does the district have the capacity to basically operate 2 districts at once?
Yes, again, a very challenging space when you're thinking about a large school district like Metro Nashville Public Schools operating in the virtual and in-person environment. It will present its challenges. But our goal as a district is to continue to offer the same level of supports to both our in-person and our virtual students. One adjustment that we will have to make off the back is with nutrition services. As many of you know, we've been providing meals at no cost to all of our students and families since actually back before the tornado to make sure that their nutritional needs were being met. We will be adjusting our nutrition services plan, not that we'll be limiting our students for having access to no-cost meals, but we will now need to use our transportation, our buses, our school buses, to ensure that we're picking up and transporting students safely to school and back home. And so we will be limiting and kind of phasing out nutrition service bus deliveries, but we will continue to offer the no-cost meals at all of our school locations.
Do you know how many of your teachers have had to go to counties away and get a vaccine? I mean, how dire is the need for a vaccine, or do you know how many have gotten?
I do not have a number of how many have gone out of county to request the vaccine. I've heard many, many conversations about teachers who have inquired and or who are willing to do so if their needs can be met, but I don't have an actual number I can put on it.
Have you gotten any guidance from the state on how soon that would be available to teachers at this point? I know that they've obviously been moved up in that phase, but have you gotten any kind of timeline as to when they would be made available to teachers?
According to the state health department timeline, for school-based staff, meaning teachers and all of our staff, including our bus drivers, nutrition services, we are looking at mid-February to mid-March is kind of the range for us to have vaccines available to begin vaccinating our staff. Now, my specific ask has been that we receive a direct allocation. We are a district that has the infrastructure to help expedite getting vaccines to all of our staff, and so we are prepared and willing to partner with the state in that effort to make sure once we get there, once the vaccines are in hand, that we can get them into the arms of our staff.
Can you tell us more about the rapid testing, like who might be tested, how frequently that would be tested? I don't know if you ever.
Yes, so the state has provided a certain allocation to all counties and all schools throughout the state of Tennessee. So those parents who consent to have their children tested, we will have a schedule biweekly where we will test students. We'll have nurses and advanced practitioners who are able to utilize the Abbott Laboratories Binax Now test and provide that for students across the school district. In the event that it requires, or there might be some uncertainty of the result, we will also provide a PCR test and send that off to a lab to be more sure about what the result might be.
You said earlier that's to help identify like possible hotspots, so is
Yes.
that like not necessarily dependent on like symptomatic, but it will just be like all the students in a school, or?
It'll be a sample size from each school. We've created a sample that's large enough to where you'll kind of know what the trends are. You'll identify where hotspots potentially might be. You might have a hotspot that's in direct relation to hotspots that are popping up on a specific side of town, and those schools happen to be on in that specific side of town. And so we want to monitor that. It's not necessarily that the school might be a hotspot, but it might be where the families reside, and we want to be able to do that. And again, both tests have different levels of sensitivity. And as we all know, a PCR test is the best possible. You know, it runs through a lab. It takes a long time to look for the SARS-CoV-2 virus in it. So we will use that as a redundancy just in case we have some ambiguity of what's happening with the rapid tests.
Real quick, I want to follow back up on that. Just so it's clear, the students and the staff that are going to be participating in the testing will have to opt into it. It's not going to be mandatory.
For Dr. Gilbert, there seems to be a second wave of children getting COVID-19, and that inflammatory infection that follows. Can you explain, is there a risk of a second wave of children, of high numbers of children getting COVID-19, if parents worry they're getting this?
I think that the surveillance that we're putting in place will allow us to quickly ascertain whether or not that's happening in the schools. That's one of the things I'm very excited about. The data is what makes the difference. You can't make decisions unless you have data to make decisions on, and that's what this is going to do for Dr. Battle and her team, is provide information about where things are happening so we can quickly isolate them, prevent them from spreading. That's key to the success. That's what the NBA model was. That's what some of the other organizations have done. That's what we're doing for the school system in Nashville.
Do we have any final questions?
Yeah, one more, Dr. Battle. And I just thought that in the course of your mentioning the DEP and the level of funding, we've heard a lot about Metro and Shelby County, particularly being underfunded in the DEP. Do you feel like one of the reasons why Nashville is one of the last, or the last school district to reopen is because the school district was hamstrung a little bit by being underfunded in the DEP? I mean, how flexible or inflexible did that make you on? Do you attribute having to wait a little bit longer to that?
I think there's no question here that the historical underfunding through the BEP for districts like Nashville and Shelby has definitely contributed to our ability to swiftly meet the needs of our students during the middle of a pandemic. You know, when we started this back in March, we had an extreme digital divide. we were not able to provide a laptop, an electronic device to every student, every MNPS student. We were also not able to immediately get connectivity to all of our students. And through a fully funded BEP program, the likelihood of our ability to have met that need much earlier than a pandemic is definitely great. We also have the challenge of being a large school district. So when you read the CDC guidelines and when you read guidance around smaller class sizes, HVAC units, when you think about the deferred maintenance and the additional needs that are there, it's very complex for a large school district. And we know that it doesn't start, this access and close contact doesn't start just in the classroom. We have to start from the time our students leave their homes. We transport a lot of our students to and from school. Thankfully, we have a commitment to doing that safely. And so in the spirit of that, we want to make sure that our phase-in is safe. And we've had to think through everything from instruction to nutrition services to transportation to make sure we provide those equitable experiences for all of our students.
I just wanted, appreciate the question. You have two areas of government, the federal and the state government. Both want the same thing, schools to be open. Federal government has provided the resources, which Meharry is going to help the school system to reopen. And the state's approach was to cut funding, which was already meager. So you have two approaches, same goal, but one is to provide the tools to get it done, and the other was possibly not to provide any tool to an underfunded school system. So I think your question does address kind of a fundamentally different approach to how to get things done in America.
All right, thanks everyone for coming out. We appreciate it.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.